Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and Dr. Ted Mitchell is the new president of Texas Tech University's Health Science Center. We've been visiting with him, talking about the overall concept that the state of Texas has developed to make sure that there's delivery, training, and supplying the needs, the medical needs in the state of Texas. And so is the University of Texas and Texas Tech the only two that have the University Health Science Center?
And you've got Texas A&M as well.
Texas A&M, okay.
And then you've actually got the University of North Texas. They have the Texas College of Osteopathic Medicine.
Okay.
But you've got the state divided up like this, but our area is West Texas. And so our area that we cover, the landmass that we cover, is larger than 46 out of the 50 states. And as we were discussing earlier, many of those counties have very, very sparsely populated areas. In fact, again, some of them have fewer than 7 people per square mile. So even when you have something as sweeping as the healthcare reform bill saying, look, we're going to provide you insurance. Well, having insurance doesn't give you access. You know, you've got folks out there that doesn't matter if they have insurance or not, if they don't have access to a system, it doesn't matter. And so when you look at what are the opportunities then for a system like Texas Tech to really shine and to really help in an area, you think about things like telemedicine. You think about things saying, okay, we've got 32 of our counties that don't have a hospital. We've got 21 of our counties that don't have a physician. So we have to still do something. 21 of those counties don't have a physician. But you have to be able to do something to have it where those people in those counties can still be connected somehow to the healthcare delivery system. And so you think about innovative things. You think about things saying, okay, can we take what would be something in those counties that everybody would know where it is and everybody would have access to it. So for example, you take a high school and you go to the nurse's office in the high school. And you say, okay, can we do something to wire that nurse's office so that if somebody needs to be seen and visit with somebody, they can then talk to somebody here in the Permian Basin, or they can talk to somebody in Lubbock or somebody in El Paso, where we have one of our academic centers, to say, listen, I'm having this issue and this issue and this issue. So you at least have some connection with somebody in the system.
And even if someone has a wreck on the Sierra Blanca Highway, Interstate 10 or something, then the paramedics that eventually get to them could even call.
Absolutely, you're connected. What you're trying to do is you're trying to extend your effective coverage area. Now, for things that are acute trauma and the like, that is more problematic because there's a physical amount of time that it takes to get someplace. But remember, and this is getting back to what we talked about at first, the things that kill most Americans are chronic diseases. So if you can set things up where you've got a good chronic disease management program, and this is part of this is a very strong emphasis that we have in our Rural Health Initiative to make sure that the folks that have diabetes and high blood pressure and cholesterol issues, chronic diseases that can lead to the illnesses that statistically will cause death, most likely in folks, if you can manage those things, if you can manage them remotely, you can have a big impact on their health care.
And we're talking about, as we've said, a third of the state land size and about a fifth or less of the state population-wise, but still they're probably more needy because they see a doctor less, or they see a health care
that's right. By the time they do engage with the healthcare system, oftentimes they've got illnesses that are more advanced. And so if you can do things to kind of catch them earlier in the spectrum of their illness. There is a program on the Lubbock campus where the students run a free health clinic at one of the local churches. And I went to visit that clinic a few months ago, and looking at one of the patients that had come through, a woman had come through for an unrelated issue, and she was found to have a markedly elevated blood sugar. So she was diabetic and didn't know it. Now,
just a coma waiting to happen.
Exactly. And it may not have been the next week or the next month or the next 3 months, but at some point in time, she would have been in the system in a very expensive fashion. And by intervening early, the hopes are that you've avoided future emergency room visits and the like, and more importantly, you've changed that woman's quality of life moving forward.
And it's and one of the nicest things that I've seen, and I think the Cooper Clinic had a lot to do with this, is how important it is to know what you're eating.
Sure.
And so as our fast food restaurants have begun to at
Pay more
least
attention.
move in that
Sure.
direction to have better choices of
Well,
food.
that's for all of us. I think that you mentioned this earlier. We grew up not paying too much attention to what we ate and the like. And what has happened is we've just had this explosion of not just fast foods, but processed foods and everything else. The typical American grocery store in the 1950s had between 3,000 and 5,000 items. The typical grocery store now has more than 40,000 items. And so when you go in and look at this, you can get overwhelmed at things trying to decide what to eat and what not to eat. When we were kids growing up, the usual thing would be to come home, grab a snack, get your homework done, and do what? Go play.
Go play, yeah.
Go
Go
outside and
to play.
Now the kids will do the same thing. They come home, they grab a snack, and the snack is usually high in saturated fat and
Loaded.
sugar. They get their homework done and they go play. But when they go play now,
On the
it's in front of the
computer.
Xbox,
That's right.
And so our behaviors have shifted in a way that have caused real issues with our health. And the problem with that is, when it comes to diabetes, for example, we're now seeing diabetes in children, but not juvenile onset diabetes, not type 1 diabetes,
yeah.
adult diabetes
That's
in
right.
children.
That's right.
And the problem with that is, those kids, when you start looking at where this is going to take them by the time they're 30 or 40 or 50, the problem's dramatic. So, and if you look at our population in West Texas, those are people that really need the help in this area. So for the Texas Tech system, trying to extend our influence, our medical influence, if you will, to those areas, whether it be through our medical groups, our nursing groups, our PA programs, which is why it's very important for the Permian Basin to thrive medically for us with Texas Tech. These are programs that we have in place that their directive will be to help provide the care needed for this area of the state.
And one of the things that we see as we move forward in this is that just getting people's attention is a really hard part
It
of
is.
it. They don't like to listen to
Right.
do away with those hamburgers and things. This has been such an interesting program with Dr. Mitchell, and we're going to come back next Sunday and continue this conversation. We've got so much to talk about because we haven't even scratched the surface about all of the different types of programs, nursing, allied health programs, and so on. And also, we haven't talked specifically about the Midland Odessa facility. So we'll see you next Sunday with another program. Good.
Thanks for joining us for News West 9's West Texas View with Johnny Lou Avery. This has been a public affairs presentation of KWAB TV and KWES TV.